In this video, we're looking at what comes up when we type general practice into Google. General practice (GP) is comprehensive, continuous, personal, primary healthcare for individuals of all ages, serving as the first point of contact in the healthcare system for diagnosing, treating common illnesses, managing chronic conditions, and referring to specialists when needed, often called family medicine or primary care in countries like the US. GPs focus on a holistic view, considering physical, mental, and social factors, providing care from birth to end of life, and promoting overall community health. Core functions: first contact, the initial point for any health concern. Broad scope, handles a wide range of conditions, from acute issues to long-term diseases. Continuity, provides ongoing care over a patient's lifetime, building long-term relationships. Coordination, refers patients to specialists and coordinates care with other services. Prevention, offers immunizations, health screenings, and advice on wellness. Key characteristics: holistic approach, considers physical, mental, and social well-being. Community focused, integrated into the local community and its needs. Versatile, deals with diverse issues, with no 2 days being the same. In different regions: UK, Australia, New Zealand, known as general practice, provided by general practitioners, GPs. USA, often termed family medicine or primary care, with doctors called family physicians or primary care physicians. General practice is personal, family, and community oriented, comprehensive primary care that includes diagnosis, continues over time, and is anticipatory as well as responsive. Definitions: a general practitioner (GP) is a doctor who is a consultant in the discipline of general practice. GPs have distinct expertise and experience in providing whole person medical care whilst managing the complexity, uncertainty, and risk associated with the continuous care they provide. GPs work at the heart of their communities, striving to provide comprehensive and equitable care for everyone, taking into account their healthcare needs, stage of life, and background. GPs work in, connect with, and lead multidisciplinary teams that care for people and their families, respecting the context in which they live, aiming to ensure all of their physical health and mental health needs are met. General practice is an academic and scientific discipline with its own educational content, research, evidence base, and clinical activity. Characteristics that define the discipline of general practice are personal person-centeredness, continuity of care, comprehensiveness, whole person care, diagnostic and therapeutic skill, coordination and clinical teamwork, continuous quality improvement, professional, clinical, and ethical standards, leadership, advocacy, and equity, continuing evolution of the specialty. The general practice model is used in countries such as the United Kingdom, Australia, New Zealand, the Netherlands, India, and South Africa. In some countries, such as the United States, similar services may be described as family medicine or primary care. The term primary care may include services provided by GPs, community nursing, allied health, pharmacy, optometrist, dentistry, and community hearing care providers. The balance of care between primary care and secondary care, which usually refers to hospital-based services, varies from place to place. In many countries, there are initiatives to move services out of hospitals into the community in the expectation that this will be cost effective and be more convenient. Premises, number and size of practices, England, registration, consultations, patient satisfaction. So, library full of charts, general practice. And we have Oxford Handbook of General Practice, which I use personally, which is, in my opinion, the best book on general practice. And that's general practice.